Hey everyone, good afternoon. This is Pat Ryan. Thank you for taking the time to join us. If you didn't step outside in the last hour, you may not have realized that we had our first, at least in Kingston, preliminary snowflakes. So winter is starting to approach, and I like to always give the weird weather updates at the beginning of this, even though I'm not a weatherman. So thanks for tuning in. We're obviously here to talk about COVID, a much more serious subject. And unfortunately, we are very much still concerned, and I would say now on a clear trajectory and into a second wave here in Ulster County, looking at the numbers. We've seen over the last few weeks a slow resurgence of COVID cases, but now the rate of new cases and really the rate of spread that we're starting to see is it's very concerning. It's also predictable in that it happened to us once in the spring, and it's also happening now a few weeks ahead of us to many of our neighbors to our south and even to our north and west, all across the state and across the country. But we're going to focus primarily on what's happening in Ulster County, and as always, we'll start with the data and the numbers. So looking at the cumulative by the numbers, we are now approaching 2,900 total cases since the beginning of COVID, and that's out of about 140,000 tests that we've completed. Over the last 7-8 months, we've been steadily and continually maintaining our robust testing capacity, testing somewhere from 500 to 1,000 people per day. And we can do more, so that is important that we all know and that we still retain that testing capacity, and that will be more and more important as we see COVID continue to increase in the county. Fortunately, of those cases, the vast majority are recovering, with over 2,300 county residents recovered since the beginning of the pandemic, but tragically, just shy of 100 fatalities from COVID in the county. Thankfully, that number of 98 has held steady for over a week now, but it's both a backwards-looking reminder of the seriousness of COVID, and as we look at the hospitalization numbers that we're going to talk about here in a second, I do fear that there's the potential for more tragedy to come given where we're at right now. And as I've said for the last week, I really want this moment to serve as a wake-up call for all of us that COVID is back, and that in some ways, if we don't get our guard back up and stay vigilant, it could even be worse than it was here in March, April, May, and into June. Looking at the hospitalization numbers, you can see on the graph a clear trend line up, and we are now at 14 hospitalized, continuing to get back to those high numbers that we saw towards the peak. We're not there yet, but we're at 12 at our last update and now up to 14. And concerningly, 3 of those are in ICU beds, and so we're seeing increased severity of the cases among some of those that are hospitalized. In terms of the active case number, this gives you a sense of how many current known COVID cases there are in the county. This graph to me is a pretty striking graph. This really shows the exact roller coaster that we've been on and that we've talked about, and unfortunately that we're now back on a clear trajectory upward in active cases. We crossed the threshold of 400 plus active cases over the weekend, which caused me to, on Saturday, actually get our key leaders of the county at the town level and other key leaders of the county together on a phone call and say, we've got to step up our game here. All of the indicators are blinking bright red, and we need to be sending that message loud and clear to all of our residents to take this seriously. That 400 active cases is definitely of serious concern. The other thing that's of serious concern is our new infection rate. In the last 24 hours, we are just under 3%. We're at 2.98%. So in the last 24 hours, we've had 35 new positive cases out of a little over 1,200 tested. More concerning than that, though, is a steady pattern of an increase in the new infection rate over the last week. In the last 72 hours, we are consistently now over a 2% new infection rate. So in the last 72 hours, we tested 3,336 tested, and had 76 new positives in that 72-hour period. So we're seeing a 2.28% infection rate over that 3-day average. And again, in the last 24 hours, that's even higher, approaching 3%. If you zoom out to the region, the Mid-Hudson region, encompassing 7 counties around us, is well over 3%, approaching 4%, and much of the state is also at the same point. So unlike in the first wave of COVID, this is now really much more evenly distributed across the state. You saw the Governor Cuomo yesterday say this is both an upstate and a downstate problem. So it really is universal, and our goal very much remains to keep this in check so that it does not go to a community spread dynamic like we were in March and early April. I and our health commissioner believe we still are in this critical but narrowing window of time where serious action and serious vigilance can really blunt the effects of this second wave. And so that's really what we're asking everyone to do. The other thing that I wanted to show today, excuse me, in terms of data, is to bring back a graph that we used to show and that we sort of took out of the rotation because we had gotten COVID back under control. But this is a graph we used to show. This shows the total cumulative cases over time. And what we generally use this to do is to project out a best case, a most likely case, and a worst case of where things could go. And this is a very important reminder that our fate is in our own hands still, and that the decisions we make collectively and individually very much shape the steepness of that curve and how sharp the increase of the second wave is. And you can see, if you look at the far left of the graph, in the early phases of COVID in the county, that very steep increase as we were seeing exponential growth of COVID, and then it leveled out. And you can visually see that we are at that critical point where, depending on which trajectory we take, it could revert back to that steep exponential spread of community spread, or we can blunt it and stay closer to that green projection and try to keep this more in check so that it does not get to that almost uncontrollable level. Again, that's up to each of us, and we'll talk a little bit more about that here in a moment. The final graph to share with you is our hospital and treatment capacity. Currently, you'll see, as I said, 14 hospitalized in the county. We're back towards numbers that we were seeing in May, and 3, unfortunately, in ICU beds using ventilator there. We do still have more than sufficient need and appreciate the continued efforts of our hospitals and healthcare partners to maintain that capacity, and hopefully we will not need to use that capacity, but we do have that if needed. Once again, I know I'm approaching broken record status at this point for the last week or 10 days, but this has to serve as a wake-up call for every one of us. These indicators, as I've already shared, 2.98% positivity rate in the last 24 hours, 418 active cases, and 14 hospitalizations. All these numbers harken back to the early days of the pandemic. And what I think each of us should try to do, as painful as it is remember how we were treating this and acting at the beginning of COVID, when we knew how serious this was, and we were seeing those effects. What were you doing then in terms of your individual behavior, not just the basics that we've always had to do of hand washing and masks and social distancing, but also staying home unless you really need to go out, not meeting with friends, keeping that social circle or that sort of bubble as small and exclusive as possible. I know these are very difficult to do, both heading into the holidays and after months of lockdowns and restrictions. But if we don't do those things, The science is very clear of where this heads. At this point, we just have to be honest and candid about that, and that's really what I will continue to do as we go forward. Some of the things we're doing at the county government level to continue to try to control this, we do have some positive developments here. Number one, we are going to continue to ask everyone's help to get the word out and the message out for those that may not be tuned in or have sort of chosen to tune out a little bit to the challenges. Please spread the word among family and friends and loved ones that these are the numbers. This is the data, that it's irrefutable, and that the trajectory is what it is. And please, getting that word out to get everyone's head back in the game, I think, is actually the most important thing that any of us can do. And hearing that message, not from me, but from someone that you know, that you trust, is going to be way more impactful. So if you're watching and you're willing to shoot a message to a few people, or share an update on social media, or however you're communicating with folks, and just say, hey, just get your head back in the game, or whatever you think will resonate with folks, please consider doing that. That will be, I think, actually the single most important thing that we can collectively do, in addition to the individual precautions. Other things that we're doing, we have brought online, finally, a limited, but some rapid testing capacity, which will let us, rather than taking days to get test results, let us take about 20 to 30 minutes per test. That's the good news. So we've retrofitted one of our buses to make that a mobile capability. We can actually bring this to potential cluster sites, whether that be at a school or a senior facility, some other high-risk facility, or wherever we may see a cluster emerging, and we can rapidly deploy those tests. The challenge is we just don't have enough of these tests yet that we can make this widely available, which is frustrating to me, and I know frustrating to many of you. So we're continuing to push for that. We're continuing to try to tap those supply chains to get more access to rapid testing. Know that in the immediate term, we're prioritizing those for those higher risk clusters of individuals that are more vulnerable, as well as our schools. Our goal through this next wave is to, of course, keep people healthy and safe, but to really try to be more targeted in how we're doing mitigation and containment of COVID. Rather than wide-scale restrictions and lockdowns, we want to really try to focus more precisely on where we're seeing the infections and get that under control. And using the rapid testing capability to do that actually benefits all of us, because we can keep COVID from going back to a community spread type of situation. So that's really our strategy at this point, while in parallel planning and asking for more rapid tests so that we can get them out more broadly to other providers and to schools. And then most importantly, the light at the end of the tunnel and the reason for long-term optimism is the very positive news now with two companies in terms of the trials with vaccine. To set realistic expectations, we don't expect to see that coming in any wide scale until into the spring. And so that leaves us several critical months of, we see the light at the end of the tunnel, but it's a long tunnel, and it could be a dangerous tunnel if we don't continue to maintain that vigilance. So I ask everybody again to keep that in mind. I ask everybody again to not slack on mask wearing, hand washing, and social distancing. These work if you work them. They work if you take this as seriously when you're out and about as when you're meeting with individuals. We've heard a lot of this term of living room spread. It's not a perfect way to describe what's happening, but that really is what's happening. Small gatherings, either for parties or just getting together with friends that I know we haven't seen in many months, but that's where unintentional transmission is happening. That's really the consistent pattern we're seeing. Even with our schools, the schools themselves are a very low point for transmission due to all the precautions. It's actually more that we're seeing the community cases come into the schools and affect teachers and bus drivers and faculty members causing issues with the schools rather than actually seeing the schools themselves as the transmission point. So again, just sharing these bits of information with you and what we're seeing and hearing so that you have not just the data, but a little bit of sort of the color and what we see as driving this. It all comes down to those individual decisions that that we are making or not making to think about others as we go about our daily business here. The other things that we are continuing to do before we wrap up, I had a call this morning with our health commissioner and our senior team here at the county with all of our 9 school districts, continue to work very closely with them. We all agree that we want to try to keep safely, of course, but try to keep schools functioning with both instruction and all the other supports needed. That's something that I think if we all take this seriously, we can keep as a realistic possibility. If we don't maintain vigilance, though, that makes it very difficult to do that. We're continuing to engage with our business leaders and figuring out how we can support them through this to keep their businesses open after one of the most difficult years in decades. That's another reason to think about your individual actions. If COVID gets out of control again, it will impact our economy. It will impact our small businesses who have already been through so much. So for all of those reasons and more, please, please, please think more broadly about your role in stopping this and feel not powerless, but really feel empowered in especially this window over the next week or two to slow this down and even stop it before it gets to a big second wave. Key, of course, to doing that will be all of our frontline workers who, throughout the first wave and the last 7-8 months, have continued to put themselves at risk in order to keep us safe and keep our economy and our society functioning. As always, I want to thank all of them, particularly our healthcare workers that are now seeing more folks coming into the hospitals and into our medical practices and other facilities. Our first responders, teachers still doing valiant work to deliver for our kids, and of course all the parents out there making that work as well, and so many more frontline workers that have been heroic and that we're going to continue to count on until we get to that light at the end of the tunnel. Thank you for tuning in. Thank you for continuing to spread the word about where we're at and to take this seriously. I know everyone watching is doing that, and I appreciate that, and I think everyone does. If you need anything or you know anyone that needs anything, you can always contact our Recovery Service Center. That number's up on the screen. It's 845-443-8888. They can answer questions about anything COVID-related, testing, contact tracing, anything like that, as well as needs for food, housing, other critical needs to get you through the coming cold weather and other things happening in your life. Please don't hesitate to reach out and share that link. And of course, all this data is always on our website at covid19.ulstercountyny.gov. That's where you can see town level data. You can see the historical trends. We want to make sure that you have all the information so you can make the best decision for you and your family and your loved ones. So thank you for tuning in. Thank you, as always, to Radio Kingston for helping us spread the word, as well as to Diane and Manuel for also helping to spread the word. We will see you. I lost track of, yeah, it's Tuesday. We'll see you for our next update on Thursday at 2 p.m. In the meantime, we'll let you know if there's anything breaking, and stay safe, healthy, and let's remain resilient through this next challenging period ahead of us.